Welcome back, and even though we are actually getting a break from the hot and humid weather for today, it's going to be back toward the end of this week, and the impact of extreme heat goes well beyond physical health. Now, experts actually say that hot weather can also take a toll on mental well-being, along with more stress, anxiety, and even feeding into depression. Joining us today to tell us more is Dr. Joshua Wartzel, a psychiatrist at Hartford Healthcare's Institute of Living and director of their Heat Mind Lab. Doctor, thank you so much for your time today. What are we looking at here? Is it really what a lot of us common sense go to with, okay, it's hot weather, people are a little bit short with you, it makes you just think differently and react differently?
So it's definitely that. But it also seems like people with mental health have difficulties regulating their temperature more than people without mental illness. And actually, we see that in studies looking at how heat affects suicide rates go up, violence goes up. We actually just put out a paper showing that probably around 100 additional youth die by suicide each summer just due to heat in the United States.
So you're saying heat can actually, it works into these numbers where you see the end result, you hear a story, you don't realize that it was actually heat that brought that person to that point. So are there things that we should look for or hear or triggers that we should say, hey, someone may need some help with this?
So, as you said in the beginning, tempers can go up, irritability, moods can go down. So, making sure that people are aware that heat can impact their mental health and that they have the resources, which includes suicide hotlines, connecting with mental health providers, parents should know, things like that.
Now, are there actually warning signs, though, ahead of time to where people are getting to these unfortunate end results?
So we know when people get overheated or heat stressed that they can be sweating a lot, the red in the face, things like that. But you can certainly get to a point where you actually stop sweating because you're not hydrated enough or your body has kind of reached its limit. So knowing the heat stress signs. But two, I think it's unfortunately we don't have any red flags in psychiatry often. It's mostly just people being aware and knowing that, hey, it's a hot day today. I might not necessarily be functioning at my best. And so I should get the help I need.
And doctor, as I like to say often, because we know we have viewers out there right now who do not even have air conditioning or a cooling system, even if you go to a grocery store or go to a store, and then, of course, check in on those same people as well. Don't you think communication is an important part?
Oh, yeah, for sure. I think I love the idea of grocery stores, but libraries, there are these cooling centers or places where you can access air conditioning during the day. Having fans especially when it's below 95 degrees, and we've been kind of riding that edge, can be very effective. Misting fans, putting your legs in a cold bath. There are strategies to keep cool even when air conditioning is not available or effective.
So as the saying goes, Doc, right, when somebody says stay cool, but we need to professionally check in on them and make sure they are okay. You could do a study on me because I'm actually a snow lover and a winter lover.
Ah, is that right? Well, we have studies going on right now. We're giving people wearable devices and thermometers to see how heat impacts their
Wow.
mood. So,
Now, can our viewers get involved, or is that not the case?
for sure. Check out our Heat Mind Lab at the Institute of Living at Hartford Healthcare. We have recruitment of new subjects, and you can learn more about what we do.
All right. Well, Doc, thanks for your time today. Keep up the great work, and again, stay cool.